Hi, my name is Jen Ejiofor. I am a graduate student at Grand Canyon University studying mental health and wellness. And today I will be telling you a little bit about some of the things you can do to help with some of the mental illnesses you hear about today, like stress, anxiety, and depression. Okay? Before we go forward, I would like to tell you a little bit about myself. I am a nurse by profession, and I'm just getting my graduate degree in mental health and wellness to help me, help my community as much as I can. Can you please tell me your name?
My name is Mr. Sivo.
Mr. Sivo, it's good to see you. I hope you're having a good day today. Well, let's talk a little bit about stress and anxiety and depression.
Okay.
Our bodies has a way of telling us what is going on inside of us. As you know, the brain registers most of what the body is feeling. And when that happens, there's always a response to either the positive or the negative. Most situations, stress is a negative experience. We get stressed for different reasons. There are many things that could cause us stress as human beings. But the way we handle the stress can either help us or hurt us in different other ways. Okay? Mental illness is when we are unable to handle, when we go through mental illness, it can escalate to problems with our general health, physical health. So when you hear about stress, what you have to think about is what exactly is stress and what is it doing to the body? Is it helping or hurting? In most situations, bad stress, the very hurtful stress, can escalate to anxiety or lead to depression. But let me tell you a little bit about stress and anxiety, and then I'll tell you some of the ways that I have learned with time and education how you can handle some of them. Stress is a very uncomfortable feeling that makes us feel, like our bodies are reacting to something uncomfortable. When it goes forward and builds up, it can lead to anxiety, which is the situation whereby we now cannot control the stress. In most cases, you hear people sweating and palpitations. Palpitations is when the heart beats fast, and that uncomfortable situation makes us feel like, maybe the world is coming to an end. We are very stressed. When we cannot handle the stress, we can get depressed. You hear people stay in the room all the time. They now cannot go outside to face other people or the public. They cannot socialize. That is from stress leading to anxiety and then to depression. A little bit about how these things can be taken care of. There are many psychotherapies and researches that have proven some of the ways you can handle some of them. I'll just mention a few. One of them is mindfulness. Mindfulness is when you are very aware of the situation and you try as much as possible to calm yourself down. Mindfulness, just like meditation. Have you heard about meditation before?
Yes.
Meditation and mindfulness kind of go together. You're very aware. You try to make your mind and body be very aware of those stressful situations. And when that happens, you can take a deep breath and try to control it as much as you can. Mindfulness can also involve being calm for a minute, being aware of your surroundings, knowing when those triggers are coming to you. Triggers are those things that will cause you distress and anxiety and depression. So if you are very aware of those situations, a lot of times you can control them. People use meditation when they are very stressed. Sometimes you just have this quiet time. You sit in a place and just probably take some deep breaths and kind of refocus. Sometimes it's very hard to get all those hurtful, painful anxiety out of our minds. But really, when you are aware, intentional, that can help you, refocus. Another way psychotherapists is try to control. These are all therapies. I want you to know that these are continuous therapies that can, with time, reduce the symptoms of stress, anxiety, and depression. I cannot tell you they will control it and stop it. It is a therapy. So what I mean by that is it's something you have to work on for a long time to really be able to control these hurtful experiences or triggers when they come. It is something you have to work on for a long time. So the next one I was going to tell you is the cognitive behavior therapy. Cognitive behavior therapy is also a psychotherapy. Kind of central to this approach is the fact that they deal with cognition and behavior. It is kind of the relationship between cognition, behavior, and emotions. So when you're able to gather yourself together, when your emotions or those triggers start coming, you kind of understand what is going on in your brain, because the brain registers it all the time. The cortisol in our bodies, that's what when it's too much cortisol in our body, we feel like jumping off the wall. It's fight and flight. So it is a difficult time, but when you can understand what's going on, that emotion is coming, the cognition of it, and then you're able to round up the behavior through control, through deep breaths. By understanding what's going on, you can now control that behavior. So these are the two main things I wanted to tell you today. Mindfulness and cognitive behavioral therapy. Those are some of the ways we can handle and be able to manage our stress, anxiety, and depression. Thank you very much. Do you have any questions?
No.
You sure?
Yes.
Okay. I hope I've helped you a little bit in learning a little today. I couldn't go into much details because of the time, but I'll be glad to answer any questions. I have my phone number. I'll give it to you. You can always call me if you have any questions, okay?
Okay.
Thank you for being here. I appreciate it.